Hello everybody, this is Dr. Anish. I am the consultant endocrinologist at Prathima Hospital at KPHB.
And I'm Dr. Sridhar Vennamaneni, internal medicine.
So today we are here to talk about diabetes. So we'll be talking about what diabetes is, what are the complications, why it's called as the silent killer, and then we'll be taking up a little bit of a Q&A session. We'll have it on the patients who are asking a few doubts on diabetes, and then you can write your doubts in the chat and we can have a discussion on that as well. So diabetes mellitus is what is commonly called as diabetes. Diabetes basically means sweet urine. Diabetes mellitus means sweet color, sweet urine. What exactly happens is it came into prominence after the assessment of sweet color urine, which had a lot of ants and all these insects around that. And then later on evaluation, it was found out that the urine was having a lot of glucose. And then on further assessment, we got to know that this was because the amount of glucose which was circulating in the blood was on the higher side. So it is generally a condition wherein the glucose is circulating for a large part in your blood. The reason behind that is the insulin is either not there or insulin is not working properly. There are actually many types of diabetes, but broadly we know about type 1 and type 2 diabetes, but we also have a few other types of diabetes like type 3 or type 4, which again has 8 types of diabetes in the type 3. So we have a lot of diabetes, but broadly if you're just looking at it, it is either the insulin not being present in the patient or the insulin not working as well as it should. And that is going to prevent the glucose from entering into the muscles, which is where the glucose is being utilized. So as a result of that, the glucose is going to go more in the blood, and then that can lead to a lot of complications.
Patients with uncontrolled diabetes, especially if your sugars are extremely high or if you have long-standing diabetes, there are microvascular complications and macrovascular. Microvascular are complications where you basically don't see them outside. They're like a small inflammation in the small vessels inside it could be in the eyes, it could be in the kidneys, it could be in your nerves. So we have different kinds of complications. The common ones that we see, you have the macrovascular, which are heart disease and kidney disease, dialysis, those kind of complications. In diabetics, the most common cause of death is cardiovascular disease, and that's in India and elsewhere, even in the United States and elsewhere. That's the number one cause of death. So our main focus all over the world is to prevent heart disease. In addition, you have complications, like I said, the kidney disease, you have neuropathies, nephropathy, you have retinopathy. All these are seen in patients with elevated blood sugars especially, or patients with long-standing blood sugars. For prevention for all these complications, there are three main important factors. One is obviously controlling the diabetes. Our main aim is to bring the A1C down to less than 7, and the other risk factors like blood pressure should be less than 130/80 mostly. In most patients, our goal is to keep it less than 130/80. And the third factor is cholesterol, which should be, our goal is to bring the LDL, the bad cholesterol, to really like less than 100 in most patients and less than 70 in patients with heart disease. And so there are a lot of other complications, but the main focus is on all these, the three main focus is controlling the sugars, controlling the blood pressure, and controlling the cholesterol.
So like Sir said, sugar, BP, cholesterol, these three have to be normal. And only if these three are normal would we get rid of ourselves of getting a macrovascular complication, which would be your heart attacks or the paralysis or any clotting in your feet or hands. And even the microvascular complications can also be prevented by getting your sugars back to a normal level. And we have umpteen studies for that. The thing is, we diagnose diabetes whenever the fasting is after 8 hours of eating in the morning. If a fasting is more than 126 and then an after food is more than 200, or if your 3-month average, which is the glycosylated hemoglobin, if that is more than 6.5, we term the patient as having diabetes. But the thing is, there is nothing in the body which says like, as soon as the sugar goes to 126, you don't get any alarm in the body. It's not like as soon as you get that, something is going to go drastically wrong. Diabetes is typically a disease which is seen as a spectrum with various sugars. Different parts of the body are involved. So the way the sugars have actually come up is initially, like way long back, the fasting was more than 140, but later on they made it 126, and that was because at a level of more than 126, the studies have showed that the risk of a person getting a retina damage, the eye damage, was higher. So similarly, if the sugars were more than 200 after 2 hours of having 75 grams of glucose, the risk of getting a cardiovascular illness is higher. So that doesn't mean that if it's more than that, you're definitely going to get it, but it's all about the risk of getting it. And similarly, even below that also, even in a pre-diabetic patient, the risk is always going to be there. So what do? We just need to get the sugars back to as low as possible. We're not doing anything drastically wrong. So a healthy diet and a healthy lifestyle, which sir always emphasizes on, that is our core in getting a diabetes back to normal. We'll have a look at a few questions which have been asked by our patients. So there's a question which says, sir, what are the common symptoms of diabetes which we can observe at the age of 40? Or basically, what are the common symptoms of diabetes? The most common symptom of diabetes is basically, if you just look at it from a common sense point of view, the sugar is going to be high in the body, and this sugar, the body is our best doctor. The body tries to get the sugar away. What does it do? It sends the sugar away from the urine initially, right? Because the threshold for the sugar, which is going to be excreted from the urine, is being overcome. So the sugar is going to go away from the urine, and when the sugar goes away from the urine, it is going to drag the water with it. So because of that, a person gets more of urination. So an increase in urination is going to be seen because of that. And because of the increase in urination, because of the loss of water, a person becomes more and more thirsty because the water content in the blood would go down. And again, because of the decrease in sugar, because as I said, the sugar is the basic fuel for our body. So let's just say you have a car, you need to put some fuel in your car. You take your car to the petrol pump. The fuel doesn't automatically come inside because the insulin, the person who is going to put the fuel in, he is going to be there. So similarly in diabetes, the insulin is not working there. The insulin is either not there or is not working. So because of that, your basic organs which are requiring the energy from glucose, they're not going to get the energy. So because of that, the body is constantly starving. So you get increase in hunger. Apart from that, a lot of people, they actually present to us with complications. So a lot of people, they present to us with paresthesias, that is pricking sensation in their feet or any burning sensation in their feet or any altered sensorium, any alterations in their gut motility, any visual disturbances, and most of the patients actually have weight loss. They have weight loss. Those who are having severely high sugars, they actually come up with weight loss to us because the body is trying to actually get more and more sugars. The body is constantly thinking that probably the sugars are not there. So the body would start breaking down all the fat and the proteins. So the weight loss is going to be seen. So we have all these symptoms, and there is one thing which I would like to tell you, that 70% of the patients who actually come to us, they don't have any symptoms. Most of the patients, if we ask them, how did you get diabetes? Like, why did you get checked? They just say we got checked because it was there in our insurance thing, or it was there in our office thing, or we just got checked just like that because my father had diabetes. So just don't go wait for symptoms. In Indians, we who are at a higher risk of getting diabetes, after an age of 30 years, just get your sugars checked at least once a year. Just get to know how your sugars are and always maintain a healthy diet.
Yeah, the next question that I have is about a patient asking about symptoms of feeling very tired once he returns from office, and if this could be from diabetes. So the answer is, there are many causes of fatigue, especially in the evenings. Diabetes itself can cause fatigue, but you definitely need to be tested for other things. You could have, in patients who could be even overweight or obese, there's a high risk of sleep apnea, a condition called sleep apnea, where you can have daytime fatigue. Blood tests would also indicate, like, you definitely, if you have fatigue, you need to be tested first of all. You need to have a complete blood test, check for anemia, check your thyroid, check for kidney disease. So there are multiple factors which can cause fatigue. And so fatigue is also, in some patients, it could be a sign of depression. So in other words, what I'm trying to say is that a complete blood work needs to be done, and further evaluation needs to be done when somebody has daytime fatigue. But diabetes could be one of the causes.
My father is 50 years old and he is still taking all kinds of food. Is that lifestyle going to increase the risk of diabetes? So let's put this across. Diabetes is definitely increased by your visceral fat, that is the fat which is there around your liver, and obesity is definitely a very high risk for getting visceral fat. But one thing is important, diet alone, while it is the most important thing, it doesn't 100% give the chance of a person getting diabetes. I mean, like you see me, right? Basically, we have a lot of people who have different body weights. Every person has a bit of a risk of getting diabetes, either because of the insulin resistance. There are a few changes in the genes which can increase the risk of insulin resistance, and every person would have a set amount of insulin which a person can make. I'll just try to make it simple. Let's just say there is, I am there and then there's a person who is half my weight and he has diabetes. What's happening is, because our weights are going up, the insulin production actually keeps increasing because a little bit of resistance is going to be there. So let's just say we are both making 10 and then we both make 20, then we make 30, then I am able to make 40, 50, 60 of insulin, example, but his cap is set at 30. So he is not able to overcome the resistance, and because of that, diabetes is actually coming up in those people. Yeah, a diet is very important, but it's important that we don't avoid most of the food which a person is interested in. Yeah, they can have it, but just keep checking your sugars. And if you get to know that the sugars are going high, then you can definitely go back, right? But absolutely go for a healthy diet. But as I said, see, most of our grandparents, they don't go for any keto diets or any diet like that. They eat whatever they have, right? So go for a healthy diet, eat more frequently, eat lesser quantity, and do your activities. That is going to take care of your diet as well. So just restricting the diet is not your best way of preventing diabetes if you are not even at a risk for diabetes. So eat healthy, but get yourself tested regularly on a yearly basis. Whenever you're giving a blood test, get your sugars checked once. Then you'll get to know whether you have diabetes or not.
The question that I have is about a patient who has feelings of pins and needles in the feet, and if it is a symptom of diabetes, and what type of diabetes it is. So when you have pins and needles in the feet, it could be multiple causes, and diabetes is definitely one of the causes. Diabetes, both type 1 and type 2 patients can have this pins and needle sensation. It's called neuropathy. And most of the time, the most common cause of diabetes is type 2, which is non-insulin resistant. I mean, it's patients who typically require mostly oral medications. Rarely type 2 diabetics require insulin also if the sugar is very high. In general medicine, we see patients with low B12, patients with lack of B12 vitamins, patients with lack of folic acid, thiamine. So multiple vitamin deficiencies can do that. You also need to be tested for like some autoimmune conditions, like lupus and rheumatoid arthritis, things that can cause inflammation in the body and inflammation in the nerves. So multiple causes that can cause pins and needles. So diabetes is one of the causes. So in general, you need to be tested again for a thorough examination to rule out diabetes and rule out B12 deficiency, which are extremely common. And then rare conditions like autoimmune conditions need to be ruled out. So, but in all diabetic patients, whether you're type 1 or type 2, there's a risk of neuropathy, especially with long-standing diabetes and elevated blood sugars.
So there's one last question, sir, which I think we can both take it. It says that, sir, we are more prone to have fast food at least twice in a week. What can we do to avoid this? The basic answer is to avoid it, but then again, if you have anything else.
What I would recommend is, especially for if you're an adult, if you're married, or if you have family, living with you, the best thing always is to plan ahead. Your meals, you have to plan your meals ahead. Because if you don't plan what you're going to have for breakfast, lunch, or dinner, you'll end up, especially if you're eating outside, you'll end up eating, fast foods, whether it's burgers or anything fat with too much carbs and too much fatty food. So the best suggestion that I would suggest is plan your meals ahead, pack your meals ahead, and the guidelines are try to increase, more fruits and vegetables. Okay, you can have your rice or chapati or whatever and some meat, but as much as possible, try to fill your plate with a lot of colorful vegetables, salads, and green leafy vegetables. It doesn't have to be raw or steamed. It could be, cooked, whatever green leafy spinach or, other green leafy vegetables. You can have any of those. But fill yourself with more vegetables and fruits, and you have to plan your meals ahead of time. Otherwise, you will end up eating outside, and that's going to be mostly unhealthy food.
Colorful vegetables, like sir said, that is extremely important. Have more of fiber. Have more of fiber, and then that's going to take care of it. And if you're having any fast food, if there's no other option, if you have to have it, have some protein before that, as it is going to get your satiation up. So you're not going to eat more after that, either ways. And we'll have a further discussion upon how we are going to go ahead with assessing our diabetic complications, how we have to go ahead and test our patients for diabetes, and what kind of medications we have. So this is a pretty big topic to talk about, but we would definitely like to see whatever queries you have, and then we'll go ahead from here on. Thank you.
Thank you.